Hi, everyone. Thank you so much for joining us this evening. We are so grateful that you're here, and we're really excited to share some inspiring stories about brain health. Just before we begin, I wanted to let everyone know that the following webinar has not been evaluated by the FDA, and the products that we're going to discuss are not intended to diagnose, treat, cure, or prevent any disease. Before we begin, I want to introduce you to a few patients whose lives have been changed by Dr. Goodenow's Plasmalogen breakthrough.
This is Thatcher on the first day of taking Plasmalogen supplements 1 year ago. And this is Thatcher today. This is how he used to walk. He could take a couple steps and then would fall down. And this is him walking today. This is how he used to play, scooting a book along the floor, not interacting at all with his siblings and responding to his name. And this is how he plays with his siblings now. He loves running and chasing them around the house. This is what it used to look like to take a walk with Thatcher, and this is what it looks like now. This is trying a new outdoor activity. He was crying. This is him trying something new outdoors now. He used to be in the hospital multiple times per year, and now he is healthy, he is happy, and he is free.
That video was a clip posted by Nicole Miranda, mother and caregiver to her son Thatcher 1 year after he started taking Plasmalogens. Most children with RCDP do not survive past 5 years of age. Very few make it into their teen years. Children and their families are told that there is no solution and that they will never recover. But with proper therapy and support, Thatcher has defied the odds. Next, we'll meet Carolyn, who's in her 70s and suffers from severe loss of mobility and cognition, including the ability to communicate through dementia. Dementia often comes with a bleak prognosis. From the pharmaceutical perspective, successful therapy in dementia is to reduce the rate of decline. We are never told that improvement is possible.
She didn't walk for a long time.
How long?
3 years.
But after just 1 month of taking Plasmalogens, Carolyn's walking again and wanting to get out of her chair.
Yeah, look at you.
So proud of herself.
Yeah, you're doing really
In fact, you may even find her doing some dancing. Judy was diagnosed with white matter disease 1 year ago.
She had trouble even making herself a cup of coffee. Like, she would go to the coffee machine quite a few times but not remember what she was doing.
After 2.5 months with Plasmalogen, she's improved her short-term memory and regained her independence.
I have a niece that travels with me some, and she's been taking over. I'm taking her back now. I've made all my lists last week, and I'll be able to run my life now. So, yeah, I get my independence back.
Our final story introduces Marion, who battled ALS, a progressive neurodegenerative disease. Historically, once diagnosed, decline is rapid and life expectancy is 2 to 5 years. After 3 weeks at Dr. Goodenow's Perpetual Health, Marion is regaining movement in her fingers and toes, and her strength and perseverance bring a glimmer of hope. These stories are so inspiring, right? And what do all of these people have in common? They are working with Dr. Goodnow and taking Plasmalogens. And we are so lucky that he is here with us today. Dr. Goodnow, welcome.
Thanks, Victoria. Happy to be here, of course.
We are really excited to begin this conversation, and we'd love to learn more about how everything we just saw is possible. So Dr. Goodnow is the author of Breaking Alzheimer's, and he has a very unique background. He was only 20 years old when he started advanced medical research. At age 24, he had already completed his PhD in psychiatric medicine and had already authored numerous peer-reviewed research papers on the neurochemistry of the brain. 30 years of relentless research later, at age 54, Dr. Goodnow is the first person to quantitatively reverse brain aging, and he used his own brain to prove it. Dr. Goodnow recently presented advanced structural and functional MRI data showing how in just 17 months, he was able to restore 15 years of brain aging using targeted brain nutrition, including plasmalogens. In the past 30 years, Dr. Goodnow has invented, patented, and developed countless technologies in chemistry, biochemistry, therapeutics, diagnostics, nutrition, and bioinformatics. Dr. Goodnow has one of the most advanced integrated medical research infrastructures in the world. He has developed this infrastructure for one reason: to build an effective community medicine program based upon the restoration and optimization of health. With over 2,000 doctors and practitioners already using his products and protocols, he is well on his way to making a difference. Please check out www.drgoodnow.com if you find the information in this webinar useful and are interested in finding one of Dr. Goodnow's certified practitioners near you to help you take your health to the next level. On this website, you can also learn more about Dr. Goodnow's research or get on the waiting list for Dr. Goodnow's Perpetual Health Center. Also, we are so excited to have a special guest joining us right before the Q&A. This guest is one of Dr. Goodnow's certified doctors, and he is here to share his firsthand experience using Prodrome Science approach and products to help his patients with autism. At the end of the webinar, we'll also be sharing a discount code just for webinar attendees, so you're not going to want to miss that. Stick tuned till the end. So I first became acquainted with you, Dr. Goodnow, and your work as a part of your collaboration with Dr. Jordan, the Regenesis Project. The Regenesis Project is a clinical research organization that's devoted to studying new technologies for brain health and regeneration. We were all blown away when 41% of the clinical trial participants showed cognitive improvement, and over 50% had improved mobility and strength in just 4 months of low-dose plasmalogen supplementation. And that was more than 2 years ago. The results you are getting now using higher doses are absolutely astounding. And I feel like it's really hard to fully comprehend the volume of research that you have done and how many research programs you currently have ongoing. Today, we are going to talk about one of the most important breakthroughs you have: your discovery that low or insufficient plasmalogen levels is a core underlying connection to the reduced brain health, autism, dementia, and even early death. But before we dive into plasmalogens in the brain, I'd love to talk more about your approach. I always hear you say that you're not treating disease, you are restoring health. I'd love to start with this concept because your protocol of restoring plasmalogen levels to improve brain health is very different than, say, a drug like Aricept that's used to treat dementia or Adderall that's used to treat ADD. Talk to me more about how you approach restoring health in terms of biochemistry. And how is it, and it's already working, so how is this a shift from our traditional view of treating disease?
Well, thank you, Victoria, for the very kind introduction. And thank all of you for showing up tonight to learn about plasmalogens and some brain health aspects of it. Yeah, this whole concept of deviation from health versus disease, it sounds like a play on words, but it really is core to this problem that we have, our failure to treat chronic diseases. And current medical practice, we look for disease. Like, disease is defined by the manifestation of symptoms. And in fact, we actually are so focused on looking for diseases that when you get a blood test that's normal, it's considered a negative result. Like, we don't actually even look for health, right? We're actually looking for disease. And we actually don't even have a really way of measuring health. Health is always measured in the absence of a disease situation. And we all fall into this category because we get taught, we go through school, and we assume what we're taught from the experts is correct. And for the most part, it is, right? Your math works and everything else works. We assume that the earth is round because someone else, like, we can't really see the roundness of the earth, but we assume that some, astronomer did proper mathematical calculations, and that's true. Like Copernicus and Kepler, these guys are, not lying to us. And so, and we build upon that. So my background is in psychiatric medicine. Like, my PhD is actually in the mechanisms of action of drugs used to treat refractory depression. So when I started getting into the medical research field, it was with that feeling of, well, our job is to diagnose disease. And I wanted to be able to diagnose disease more accurately and earlier. And so that we could fix disease faster in individuals. And so my background as a chemist and a biochemist and as a neurochemist, I invented a technology using ion cyclotron mass spectrometry that allowed me to measure thousands and thousands of biomarkers simultaneously, these biochemical molecules that are floating in your blood, if you will. Because if someone has a disease versus someone without a disease, there should be a biochemical representation of that. And this technology is extremely powerful, and it truly is remarkable. We have 2 ion cyclotrons right here in our labs in Temecula, for example. So I used this technology and applied it to multiple diseases: colon cancer, ovarian cancer, bipolar disease, dementia. And it truly does identify biochemical changes. But the assumption is that the disease is causing the biochemical changes. And so we did one of the largest colonoscopy trials in Canadian history. We did about just under 5,000 colonoscopies in the province of Saskatchewan and about 1,000 controls in the region, and we were able to, with a simple blood test, diagnose or accurately predict 86 to 87% of early stage colon cancer, stage 0 to stage 1. And so then we want to say, okay, well, we got these biomarkers of colon cancer that are very, very accurate early in the disease process. And we want to say, okay, assuming this is true, then if we did a study where we looked at people's blood samples before colon cancer tumor removal and after, that if we remove the tumor, these biomarkers should restore back to normality. And so we did the study in a university in Japan at Osaka University, and we looked at people's before and after surgical removal of the colon cancer tumors. And we found that the biomarkers didn't change. So removing the tumor had no impact on the colon cancer biomarkers. This is not what we expected to see. We were assuming that this was going to be a slam dunk, take the tumor away, biomarkers are going to go back to normal. And so we didn't even believe it. Like, this can't be right. So we redid the entire study over again in a university in Chiba, Japan, same demographics, but a totally different university infrastructure, and got exactly the same results. So therefore, we had to rethink this, because the only logical or the only scientifically valid explanation of this observation was that these biomarkers were changing before the cancer was happening. So these are actually biomarkers of dysfunction, or it's a deviation from health. There was a health state because they weren't healthy. They weren't considered normal levels. And so there was a deviation from health, but this deviation from health occurs much earlier than the disease process itself happens. And so this is where the whole concept of prodromes comes in, because this is the ability to predict future outcomes based upon these biochemical changes. And we're not actually diagnosing disease. We're diagnosing people who will get future disease, which is a very different concept. And it's this concept of, we get trapped into this absence of a negative as a positive. And this is like, we live in this paycheck to paycheck world where as long as our bills are paid every day, technically we think we're normal, but we still feel this sense of health anxiety, if you will. Like, we just don't know if my car breaks down, or I have my water heater breaks down. Do I have enough money to pay these events in my life? And that's what health feels like to a lot of people, because they're just kind of getting by. And from a health perspective, they're considered normal, but they have no reserve capacity, and they have no vitality in terms of health. And so that's kind of where my focus shifted from these discoveries to saying, we have to start looking at health and what is prodromes, not just of a disease. How do I predict negative things that can happen to people, but can I predict positive things? Can we restore health? We can understand the underpinnings of health and vitality and start focusing on those issues, because health and disease can't coexist with each other. You can't be sick and healthy at the same time. And it's not really even preventing medicine then. So those wonderful observations in Carolyn and Thatcher and Marion, those people are not getting their diseases treated. Like, ALS is not being treated. Dementia is not being treated. Okay, health is just being restored. We're just we're not focusing on the disease whatsoever. We're trying, how do we restore function? How do we restore cellular function in these individuals and ignore the disease process fundamentally?
That is such a radical shift, thinking about restoring health versus treating symptoms of disease. And these stories that we saw are showing that people are resilient and that they do have the ability to, heal themselves with the right tools. So I think this is such an important and powerful shift. And I'd love to talk more about it. So there are these prodromes for, disease outcomes. Are there also prodromes for longevity and health?
Yeah, so, and that's exactly what we want to look in more detail. This is where the plasmalogen story gets really quite interesting. And like I say before, I say it's exciting, it's scary, it's hopeful. When we're doing these longitudinal studies in Chicago, we're looking at plasmalogens because we have these large studies, longitudinal studies, where we have individuals before they get cognitive impairment, and then we also contract them till they die. And we found that plasmalogen levels were affecting 30 years of their lifespan. So the 5-year mortality in a 95-year-old with high plasmalogens was the same as a 65-year-old with low plasmalogens. So you have this very dramatic effect on life. And so this whole plasmalogen story came about with this technology as well. So I'd already had this understanding with the colon cancer situation. And then we were doing a project in San Diego, actually, on looking at dementia, different rates of severity. And this is where the same technology, the same ion cyclotrons that we use here today, those were used they discovered these molecules that were deficient in individuals that had cognitive impairment. And the lower the level was, the more likely or the more severe the dementia was. Furthermore, the lower the level was, the faster the rate of decline of cognitive function in those individuals was. So and I didn't know what these were at the same time. Like that's the joy of this technology, is that you don't really know what you're looking for before you find it. And so after you find it, you have to go, and that's what advanced mass spectrometry allows us to do in bioinformatics. And so I found these molecules were plasmalogens. Well, it's like and it's exciting, but embarrassing at the same time. Like my PhD is in neurochemistry. These are molecules that make up literally 20-30% of your entire brain volume. Like your myelin sheath that protects your axons, it's like 80% of them are plasmalogens, your synaptic cleft. And it never showed up. There was not a single university course that mentioned plasmalogens.
That is so interesting. I want to pause for a second, because this is really profound to me, that you're basically studying biochemistry of healthy people. You're looking for patterns. You're looking at the difference between someone who's healthy and someone who's not healthy. And then you're kind of reverse engineering a roadmap to longevity. And plasmalogens, which we're all here to talk about this breakthrough, a little background for some people, like Dr. Goodnow mentioned, they make up 20 to 30% of your brain and 50% of your heart lipids. And they seem to be a staple ingredient, not just for longevity, but also are radically transforming the lives of people suffering from Alzheimer's to autism. So very important and powerful molecule. Tell us more before we dive in, like, what are plasmalogens and how did you find them, and how are they having such a profound impact on people's health?
Yeah, so plasmalogens are a type of lipid. And so the human body, like, you're not a bowl of soup, right? Like, you're actually structured, like there's 30 trillion cells in your body, right? That give you your physical structure, whether it's your heart or your lungs or a part of your arteries, if you will. And these cells are defined by a three-dimensional walls, just like the walls of an apartment building would have. And your body is not made, of course, of plaster and wood. It's made up of living material. And the living material that makes up these walls are called phospholipids. And then you don't have just the walls on the outside of your apartment. You have the walls that separate your kitchen from your bathroom. And you have a wall that separates your refrigerator and your stove from each other. All of these things are biological membranes. And plasmalogens are a critical component of those biological membranes. So they are literally in everything in the body. And they change because you'll have different structures, just like your wall will have windows and doors in them. They'll have different areas of the walls that have different functions. And if your walls aren't working properly, all of a sudden you can't open and close the door or things. So these walls allow material going into your cells and out of your cells. The proteins that are embedded in those membranes are affected by these plasmalogens. And so these plasmalogens are modifiers of all these biological membranes.
So they're in all of these. So it's like if your body was an apartment complex, it's the walls of your apartment, but it's the walls of your room, it's the walls of your oven, like all of the different parts of your body.
And so when your brain shrinks, when your body
Uh-huh.
shrinks, okay, one of the things, like, so a lot of your body, like we're not plants, right? You're not taking sunlight and water and carbon dioxide and creating material. So whatever you see, okay, either it came in your diet, you ate it or you made it. Okay, fundamentally, that's the human body. Like everything that you see, either you ate it or you made it. And so plasmalogens are one of those molecules that you actually make. Your body makes lots of it typically. And that's really why it kind of escaped this kind of seriousness late in life, because typically people make a lot of it. It's not dietarily available. And so it's a very interesting molecule, which actually turned into its own detective story once, they were identified being so important.
Yeah, so it sounds like you've kind of discovered that there's this vitamin that we all should be taking and that we haven't been. Is it similar to that?
Yeah, well, actually, I patented a whole disease called age-associated plasmalogen deficiencies, because they're low in cancer, they're low in Alzheimer's, they're low in Parkinson's, they're low in autism, myelination, asthmatics, ALS, multiple sclerosis. So these diseases that affect us as the aging process, or even early childhood development. So to rewind just a little bit, though, when we were talking about, so when I first discovered these plasmalogens, again, I had no idea what they were. And so I had to look it up, but I wasn't the person who discovered the existence of plasmalogens. These were discovered back in the 1920s. So we've known about them for almost 100 years. And more importantly, we know how important they are. So the little boy Thatcher that you saw in the early video, like that is your prototype plasmalogen deficiency. So children that are born with a rare disease called rhizomelic chondrodysplasia punctata. These children are born with 100% normal genetic material. Like they're totally normal except for one thing. They have a mutation in one of the proteins that make plasmalogens. That's it. Their cholesterol is fine. Everything else is normal, but there's a very precise genetic mutation that the only thing that these children cannot make is plasmalogens. So you can quickly ask the question then, what parts of human physiology are affected by plasmalogen deficiency? Because these children everything you see with these children is due to the plasmalogen deficiency. So what happens? They're born with dwarfism. Okay, they don't grow. They have musculoskeletal issues. They have no muscle strength. They can't. The severe ones, they can't even move their heads. Like they're immobile. There's white matter defects of their brain. And typically when they live for a few years, but when they do die, they typically die of pulmonary. Like most of them go in the hospitals. Like Nicole was saying, Thatcher would be in the hospital multiple times. They'll have lung issues. They'll have heart issues. Those are all the things that affect us as we get older, right? And we talk about, and one of the biggest things with Thatcher was when he first started taking plasmalogens, the first thing that happened was his echocardiograms returned to normal. So he restored heart function. So when we started looking at RCDP, we knew all this. So when I discovered this association, this age association with Alzheimer's disease and dementia back in mid-2000s, all of this research and all the knowledge about plasmalogens, that was already in the books, right? People had been studying these things. Early childhood development, the critical nature of plasmalogens for the myelination of the brain, all that was there. So there wasn't a lack of knowledge, but it was really quite weird that nobody had been doing anything about it. And that's really where the next part came in. So it was pretty obvious low plasmalogens are bad. Like that's not something that's not really open for question. It's not something that you want to be deficient in.
Yeah, so you'd mentioned that they're not, I think you said biochemically or bioavailable. Does that mean that we can't eat foods that have plasmalogens? Or like, if we've noticed this connection, why weren't people just replacing plasmalogens? And
they were trying, but they couldn't do it. Because so plasmalogen, when your body makes these plasmalogens, they're extremely sensitive to acid. So as soon as obviously like, you know, have plasmalogens, then animals will have plasmalogens. You eat a nice steak, there's going to be plasmalogens in that. But they're very sensitive to acid. So as soon as they hit the hydrochloric acid of your stomachs, they burst apart. So they're not biologically available. The only nutritional source of any consequence is actually human breast milk. So ironically, or not ironically, interestingly, like the human body is kind of adapted to that. So that's why breastfeeding is so important, especially for the first 6 to 12 months of a child's life, because that's when the myelination process of the brain occurs. And so when you look at all these studies where you look at breastfed versus non-breastfed babies and changes in brain development and developmental delay differences. A lot of that is actually due, there's other healthy things in breast milk as well, of course, but the real core factor is this plasmalogens in breast milk. And so it wasn't like people didn't know plasmalogens was bad, they weren't able to restore them. And this is where, for me, when I discovered the plasmalogen deficiency associations with all these age-associated diseases, was the only way we could study plasmalogens was we had to solve this plasmalogen restoration problem. Because unless we can restore plasmalogens, we can't even study anything. And this is where being the right person in the right place, the right time, like I'm a chemist. I'm a synthetic organic chemist. I'm a medicinal chemist. So the next question was, come on, this can't be impossible. There's got to be a way. Like, this is ridiculous. And so there's got to be a way to do this thing. And so that was my next really series of patents and inventions, were identifying how to actually restore plasmalogen levels. And it just turned out we had to build we had to build 3/4 of the molecule first. And then once that was built, we could restore plasmalogen, and we could restore them on demand. Like, we could restore white matter plasmalogens for the myelin specifically, and we could restore the omega-3 plasmalogens for reverse cholesterol transport or neuromuscular function or synaptic function. So we could design plasmalogen precursors, which are all natural, by the way. They're actually your own internal biochemical intermediates. So this is simply straight up human metabolic engineering, if you will. We're actually just plugging in precursors and letting your body do the rest. Like, we're not really doing anything.
You're giving your body the raw materials to make its own plasmalogen.
Yeah,
right?
and you're getting it into the cells. It's actually getting to the place so they can go and build the plasmalogens they want. So when you take Prodrome glia, which is the omega-9 version, it actually goes into the oligodendrocytes of the cells that make the myelin sheath, and they can make their plasmalogens. Or when you take omega-3, it goes directly into those things. So that was the biggest thing. So then once I was able to invent plasmalogen precursors that could restore plasmalogens on demand, now we could actually get to the nuts and bolts of saying, what do these things really do? And so we did a whole bunch, like years and years of preclinical research on animal studies and cell culture. Turns out that we increase plasmalogens, we can reduce the amyloid formation of the pathological protein in Alzheimer's disease. We could improve reverse cholesterol transport by the cholesterol transport mechanism. Myelination of the brain can be maintained in under oxidative stress, like a Cooper's own models, like Parkinsonian models, where you have synaptic disruption with neurotoxins could be prevented. So the whole concept of this was that if you can maintain health, if you can make that cell or that animal healthy enough to maintain their neurological structure, they are very, very resistant to these toxic insults. Okay, they can actually sustain and maintain function. And this is the real powerful part. Maintaining function is all you really have to worry about. If those oligodendrocytes can make myelin, a child's not going to get autism. Okay, if the neurons can make omega-3 plasmalogens and maintain vesicular release of acetylcholine, you're not going to get dementia. Okay, it just basically, and it's not about preventing something. It's just about making sure the system works the way it's designed to work.
And has all the materials and ingredients that your body needs to just do what it's meant to do, what it was destined to do. So can we talk a little bit about the omega-3 and the omega-9 and the prodrome glia and prodrome neuro? They're both plasmalogens. We saw the videos in the beginning of the patients. Are they taking both? Are they taking one? Let's dive in a little bit more about how each of them works in the brain and how they're different.
Yeah, so the omega-9 is oleic acid. And so what we do is we actually design a molecule so different types of plasmalogens have different functions. So the omega-9, which is oleic acid containing, but the plasmalogen backbone is important.
Is that glia?
That's the glia. It creates a very tight packing structure. So the myelin sheath that protects all your axons, it's like taking electrical tape and wrapping it around a copper wire, right? You want a thick, tight coating on that. And it's supposed to be impervious to oxidative stress damage, for example, and making sure that because you got long distances, like your neurons will go from your brain to your spinal cord, from your spinal cord all the way down to your toes. Like these are very long tracks, and the signal has to go long distances. It's the myelination of those axons that allow that to happen. And that's that white matter. And that's what's really affected mostly in children with autism, for example. And then in age-associated cognitive decline, it's the other part. It's the omega-3s, the DHA. So many people hear of docosahexaenoic acid. It's from fish. Often we associate it with marine animals, but that's a fatty acid. Again, but it has to be on the plasmalogen backbone. So those are the two different types that are the core.
And that was Prodrome Neuro. So Prodrome Neuro is different. It's not just an omega-3. It's a plasmalogen with an omega-3 backbone.
Yeah, it's very pure. It's actually, and maybe we'll talk a little bit later about that, but it's an incredibly purified omega-3 source. So it's pretty exciting on that one. But yeah, so that's kind of where this whole concept of it. And then as the role of plasmalogens expanded from one disease. Okay, so the first role was this dementia and Alzheimer's, and the association with the different aspects of it. And if, like Victoria put up the book, you know, Breaking Alzheimer's. If you want to get into the details of plasmalogens and all the aspects of Alzheimer's physiology, it's in the book. There's charts and tables and lots of research in there, and it's written for everybody. Okay, so but it's not patronizing. It does tell you the real science, and hopefully I can explain enough that you can actually get through it. But I didn't water it down for everybody, so it has the real stuff in there.
Well, you have a real science background, and you're a researcher and a scientist, and you've developed this, and you've done research and clinical trials. That's how we met.
Well, and we started, so all this happened, right? And we've only been available. So for all of you on board here today, like we're only talking a couple of years. Like this is not like I redesigned it to be a natural supplement from a drug-based molecule started in 2016, 17. And I think around 2020 is when the first human availability, and we did the trial with Dr. Jordan in 2021, right? And we just wanted to reproduce what we'd already done extensively in the preclinical.
And we were just trying to show that by taking a plasmalogen supplement, you could increase the levels of a bit plasmalogen in the blood. Like we were very elementary. We were just trying to show that taking it would increase it. We were not expecting that, 41% of people would have reversed. So gone from moderate to mild or mild to no cognitive impairment. Like we were pretty shocked by the results. That was not what we were expecting.
And we really had no idea how much people really needed either.
Yeah.
Okay, you take a little, so the highest dose that clinical trial did was 4 mils, which would be 8 gel caps, essentially, right? And little Thatcher takes 3-4 times that per day. He's a little 6-year-old boy, and he's taking like 15 mils of plasmalogens a day.
But he also doesn't make any himself.
Doesn't make any plasma. Yeah. But so we've learned over experience of time, and now we have thousands and thousands of people on plasmalogens, and each person kind of optimizes it for their own course, right? And so we've learned a lot more over the last couple of years, in the reality of things.
Yeah.
And that's really the power of just really understanding, basically this concept of restoring health. It seems such a simple little concept, and the trick really is being able to measure it, and start measuring health versus just focusing on chasing one disease after another.
Yeah. And you being a researcher, have done these clinical trials, and you've kind of made this really sophisticated yet simple solution. And you've also been able to partner with over 2,000 doctors who are actually in the trenches with the patients, because you're in the lab, which is where we want you discovering these things. But
like we got freezers full of 50, 60,000 blood samples. We do large clinical trials of thousands and thousands of individuals. Like I'm not your doctor on the street. Like I'm not an MD. I don't actually treat patients in that sense. And so it's been such a rewarding experience, really, to work with these advanced doctors. And that's, you have a special guest here today to talk a little bit about his experiences. But that's, it's, you kind of get to the thing. There's an old cliche, like there's people that think and there's people that do, right? There's like you can think these solutions, but there's lots of solutions that happen in this world that never meet there's a lot of smart people that nothing happens. And there's lots of people that are actually out there doing things, right? And they're in the world.
Yeah.
And what we're trying to do is match those two things, right? And the doctors, the certified doctors, they have enormous experience from years of trying difficult problems, simple problems, difficult problems. And there's no substitute for that experience, because everyone's circumstances will always be slightly unique.
Yeah. And we are so lucky to welcome one of those doctors who's here with us tonight, Dr. Raden. Hey, Dr. Raden.
Hi, how are you today?
I'm good. Thank you so much. I know you're a busy man seeing a lot of patients. Thank you so much for joining us tonight.
Well, thank you for having me.
Of course. So just for the audience, a little background on Dr. Raden. He has over 20 years of experience with hands-on medicine in the trenches with the patients, and he has truly seen it all. He blends expertise in traditional medicine with a comprehensive understanding of functional medicine and cellular biology. Dr. Raden offers a progressive approach to health that works to improve biological insults that could induce medical conditions and decrease life quality. He's analytical, perceptive, and very kind, and he often succeeds where conventional methods have failed, treating everything from common disorders to diagnoses that may have gone unresolved for years. His specialties include immune system dysregulation, precision medicine, athletic performance and sports medicine, anti-aging medicine, chronic illness, neurodegenerative diseases, environmental medicine, peptides, cellular health, and autism. Before we begin, I'm going to share a video that we have permission from one of Dr. Raden's patients. I believe they texted you this video to share with you, and so we're going to share it with everyone right now. This is a before and after for one of Dr. Raden's patients.
Nice job, bud. Are you beating Dad? Oh. Look up, bud. Yes. Way to go, Shawno. Amazing. Fantastic. Was that fun, bud?
So what was that experience like? Tell us more about that patient and your experience working with that family.
Yeah, I'd like to first thank the family for offering the video, because I think pictures speak louder than words. But the history of that individual, I've been working with him for probably 10 years now. And I felt that in my personal perspective, autism is brought on by multiple insults. For the 15 years I've tried to master autism, and I can tell families prior to the introduction of knowing Dayan that I can give them objective information. I can tell them that their child has an immune dysregulated physiology. I can tell them that they've been exposed to metals. I can tell them that they have insults like infections. But the complications were the interventions. And unfortunately, many of the interventions did not make children better. They actually sometimes made them worse. And it was very complicated for me to walk into an office and show them the objective science of their child's condition, but lead them down the path that did not lead to clinical benefit. What was very interesting over my years and years of research is that I realized that all of these insults lead back to the cell. So if we have a toxic burden of metals, if we have infections, if we have nutritional deficiencies, at the end of the day, what is ultimately affected is the cellular metabolic pathways of the body. And what's most susceptible? The brain cell. So what I did is I started listening and reading journals and articles about how do we improve the foundation of health, which is the cell metabolic pathways. Rather than chasing the 101 pathogens or all the different triggers, why don't we just take a leap of faith and just focus on the cell? And I offered that parents, Sean's parents, that suggestion because we had tried everything with this boy. We had done antibiotics. We had done IVIG. He had been chelated with metals. He had cleared infections, but he wasn't better. And the video shows after 10 years of experience what the end result was. So I thought in my mind, well, we have nothing to lose. I've read enough about the biochemistry of the cell. Let's use something that could improve the cell function. Let's introduce plasmalogens to not only turn off and extinguish the fire internally triggered by the insults, but also use a molecule that has the ability for remyelination of the brain. And in so being, after 1 week, I received this text from the mother, and it brought tears to my eyes, and still does actually. Like, with the years and years and years of efforts with these children and the things that parents have gone through, it's incredible that we now have an opportunity to expand medicine and to allow people not only to use objective science, but to apply something that could theoretically provide their child and their family relief from the traumas they've been through. And as my journey, it is my goal to offer this to others that have been suffering and struggling. And what the plasmalogens provide me is actually to walk into a room excited to see an autistic child versus the fear of knowing, what can I really do to help this child? So I thank Dane for the brilliance of his science mind and the ability to create this molecule, because it's revolutionized my practice.
That is so inspiring. So before, was your approach, as you were taught in school, kind of to go after the symptoms of the disease? And that's why, for 10 years you were trying all of these different, therapies, and they weren't working. What was the shift for you? You said when you went to the cellular level?
Yeah, so if we think about disease states, we don't acquire diseases out of nowhere. So we have a diagnosis and we have symptoms. But if we take a step back, there has to be an insult to the biochemistry of the body in order to induce a disease. So I fully believe in pharmaceutical interventions to tackle the symptoms, to give people improvements in their quality of life.
Absolutely.
Rather than just targeting the symptom relief, why don't we go back to the core element of life, which is the cell? I don't care if it's a brain cell, a heart cell, a muscle cell. All organs are made up of cells. And if we can correct the physiology of the cell, can we move the body towards health? And that has been my motto in the world of medical care. Once we solidify the foundation of cellular metabolism, we can see progress and move the body towards a healthy state. And in turn, symptoms can be reduced, as seen in this case with Sean.
Yeah, it seems like, I'm sure to his family, it felt like a miracle.
Well, it was a miracle for me because I have to say, with full transparency, I kind of gave up on offering suggestions to chronic disease states when I didn't have answers. And I not only work with autistic individuals, but this applies to many more conditions because, again, a cell is the foundation of health.
Yeah.
And if we can focus on biochemical cellular metabolism, we can improve that function. Physiology improves, we move towards a place of health. That's the way I look at medicine.
Thank you so much for sharing. And I'm excited for all of the patients who are going to meet you and get this kind of repeated miracle situation happening where we kind of know what happened and we can replicate it. That's really, really exciting. Thank you so much, Dr. Raden,
Thanks,
for
Dr.
sharing.
Raden. And it's such an interesting thing because, like, when from a clinical trial perspective, like that's what I've done. All these, like, we have to design everything. The opportunity we have with all of our certified doctors in the real world, we can do complex medicine in an iterative way that's not possible from a traditional pharmaceutical approach, which is one drug, one indication. You can't really combine multiple things together. But when you're dealing with health and basic nutrition, you have to look at a combined approach. And the network of doctors now and their experiences and the ability to iterate or titrate based upon circumstances, because it is not a one size fits all for everybody. Okay, the plasmalogens are critically important, but there are other things that you need to address and different doses for different people. Like we'll have with the ALS patients like Marion, those people are taking very, very high doses, more than what most people would need to take, but they're dealing with a very serious situation that needs to be reversed. And this is where having a skilled practitioner on your side is just invaluable. It's an invaluable process. And so, yeah, it's for me, the rewarding process of being able to deal with real people is so rewarding. And that's why and for those of you listening, we do have a rare disease charity. So all these children with RCDP, leukodystrophies, point mutations in their mitochondria, like we treat these individuals free of charge. And so we have that charity that we deal with. And it's when I talk about community medicine, we really mean that. It's about nutrition and it's about restoring health, and it's getting these networks of doctors in place. Like little Thatcher, from a pharmaceutical drug perspective, these rare diseases, a treatment for Thatcher of that magnitude would typically be $400,000 per year. Okay, this is what these rare diseases, and so the exploitation of these rare diseases are really quite disturbing to me. And so we've really made an effort to reach out to families with rare diseases and things that we can actually, we can't solve every single problem on the earth, but we can, whatever we can do to help, we're here to help.
And it's so incredible. It's so incredible that this is it's a natural solution that you don't need a prescription to get. And speaking of those high price tags, some of the FDA approved options for dementia are, $50,000 plus a year. And we're not really seeing a reversal. We're seeing a slow of a decline. So it's just the plasmalogens, to me, after hearing your story, are kind of just the beginning when you take a new approach to restoring health. But I am super curious if we could, what does a plasmalogen
what actually
look
are
like?
they, right? What are they actually, what do they look like?
What the heck are these things?
Where are these things? So a lot of people think about, okay, it's an omega-3. So they hear omega-3 and they hear omega-3
We've heard
fatty
those
acids,
a lot,
right?
yeah.
And omega-3 is from everywhere. So what we do, what makes these plasmalogens unique is that, first of all, you can't have a final plasmalogen because it gets digested in the stomach, right? So you need a plasmalogen precursor, which is what human breast milk does. It creates what's called an alkyl glycerol. And what I invented was what I discovered, and through trial and error, realizing that we actually had to have the molecule pretty well packaged. So when we talk about Prodrome Neuro, what we're doing is it's a vegetarian product. We use algae oil as the source of DHA, but that's not where we start. So when you want to get if you want to look what DHA looks like, so this is what pure DHA looks like. So we take a product like an algae oil, which has like 50-60% DHA in it. We purify it, saponify it, get rid of all the glycerols and everything else, and we purify this. This is virtually 100% omega-3. It's the highest concentration you have, but that's just the DHA part. That's not a plasmalogen. What you have to do is we have to combine it with the plasmalogen backbone. So when you combine the plasmalogen backbone with the DHA together, these two together is what gives you this Prodrome Neuro. Okay, that's the liquid that's in here, and there's nothing else in it. Okay, if you read the back, it says other ingredients. Okay, it says clove oil and cinnamon bark oil, because a large omega-3 is very sensitive to oxidative stress, which is why once you open one of these bottles, you should use it fairly quickly. It's natural. It's not designed with preservatives to last 500 years. Okay, that's not what it's for. Okay, so we use clove oil and cinnamon bark to keep it, and when we put it into a gel cap, okay, what's in the gel cap is exactly what's in this bottle. Nothing, there's no modifications. We just create the gel formation, and unfortunately it is a gelatin capsule, so it's not, and this is what it looks like when it goes into a gel cap.
Oh, so they're very small.
Very small.
When I think of omega-3, when I get mine at the store, the pills are really big. So yours are small so that the kids with autism, it's easier to swallow, right?
And the adults. That's the biggest issue we have with this advanced nutrition, right? And that's why the liquids are available, because one of the biggest challenges that we have is being able to implement things. Like the science doesn't matter if someone can't actually take the supplements that are required for restoring the nutrient, right? Like when we talk about creatine and carnitines and all the other, there's things the human body needs, like your biochemical, reactor. So that's how neuro is made. The glia is even more pure because it uses oleic acid. So this is oleic acid. We use the sunflower as a source, but there's no sunflower in the product. So just like we take algae oil and we saponify it, basically get rid of the glycerols, and we purify the pure oleic acid. And then this gets combined with the exact same backbone that we use for neuro. So when you put these two together, you get prodrome glia, plasmalogen plus the omega-9. And that's what goes into the glia product. And it's pure oil. There's nothing in it. If you look at the ingredients, other ingredients, none. Okay, there's nothing in it. So if you want, and this is stuff it's really easy. You can mix it in with your food. It's pretty bulletproof. Like the nice thing about oleic acid or omega-9s is that they're very, very stable. Like this pretty well lasts forever. Like
so I think this is a perfect segue into some of the Q&As. People are asking, do you also need to take an essential fatty acid if you're taking a plasmalogen, or does it replace an omega-3? This is Lisa's question. She's asking, how are plasmalogens uniquely different from EFAs? In other words, why won't taking significant amount of EFAs just do the same thing?
So that's actually sounds like a simple question, but it's actually quite a loaded question. So you have, technically speaking, your essential fatty acids are omega-6 and omega-3. Omega-9, which is this oleic acid, is technically not essential. Humans make oleic acid, the omega-9. In fact, that's why when we take certain animal products, that you want to get the omega-9 from the animal products. Plants make a lot of omega-6, which is linoleic acid. So omega-6 linoleic acid, human body can't make oleic acid, make linoleic acid, which makes it an essential fatty acid. And the other molecule that humans can't make is called omega-3. And the core of that would be alpha-linolenic acid, say from flax oil. From those essential fatty acids, your body can then make longer chain molecules like arachidonic acid, which is the omega-6 version, or DHA, which is omega-3 version. So those are your essential fatty acids. But like a lot of things in this world, just because you can make it doesn't mean you can make enough of it, right? And so what we've considered as non-essential, so technically speaking, omega-3 DHA is not, it would be technically a non-essential fatty acid because technically the body can make it, but we just don't make enough of it, and it's difficult to get enough of it in our dietary supply to sustain us. So long answer to your question is no. When you take Prodrome Neuro, you do not need to take any other omega-3 supplement. It's the purest form of DHA as well, because it will share its DHA with other molecules. It's really, it's the most bioavailable omega-3 ever made. It's designed to be absorbed in the upper GI tract. It goes right onto your chylomicrons, bypasses the liver, feeds your brain and your muscles instantly. And so it's a very, and same thing with the omega. Like human physiology is pretty exciting if you think about it. Like breastfeeding is pretty amazing because it's the same thing. Like the food supply, like breast milk is 80% whey protein, 20% casein, and these plasmalogens are in there. And so it's actually, when you talk about perfect food, it's also perfect absorption. So the prodrome glia, this thing here, this is actually in breast milk. If we do mass spectrometry analysis of breast milk and this, same molecule. And so unfortunately, when you get to my age, it's hard to get breast milk sourcing. So you have to take the prodrome glia.
So I have another question from Philip. He said, I have had one of my grandfathers die from Alzheimer's and an aunt that died from early onset Alzheimer's. There's also a history of prostate cancer in my family. I'm 46. Is there a particular age that is recommended to test for adequate plasmalogen levels? And at what levels would be considered normal?
That's a good question. This actually really raises this whole concept of optimal health and this concept of aging. There's a lot of people out there trying to say aging is a disease, and it's not. Okay. The best way to think about it is we talk about this paycheck to paycheck situation, and you build a savings account. Plasmalogens are a type of molecule that you build a savings account of. You build them up over years, over decades. Your heart builds them up, your brain builds them up, and you kind of slowly completely more and more accumulating. And then when you get an oxidative stress, like what's happening now in today's world with all the COVID and the myocarditis and brain fog, a lot of these things are being caused because that reserve of plasmalogens has been depleted. And in many ways, aging is like a reverse mortgage. Like you've built up over time, you've been working hard, you've been saving your money, you've been put your money, you got extra savings, so you're putting it into the equity of your house. Then at some point in time, you say, well, I'm no longer making any money anymore, so I'm going to draw down from these reserves. And that's fine. Well, it's not fine. I think it's the worst thing in the world, because it's basically just all you're doing is trying to predict the length to your death. So I think people should, but we want it for longevity perspective for plasmalogen. So yes, so you should look into it, because there's other situations that can have low plasmalogens, autoimmune situations, other things can really knock your plasmalogens down early on. That's why we're seeing, especially a lot of this today's day and age with long COVID, and the myocarditis. And we do a lot of blood testing every week from all around the world. And I can tell you that there's been a shift over the last couple of years. There's a lot more plasmalogen deficient individuals than there should be. And so we are getting this, there is some overall stress, and I won't get into the whole, COVID vaccine situation, but there is overall in this world around us, there is an extra stress. It appears to be an extra stress on the entire human population going on right now. So yes, the answer to that question is, you want to start early. You want to build a savings account, and you want to maintain it. And if you maintain health and function, even if you're E4 or E4 carriers, like these are statistical predictors, but they're not absolute.
So Tamara is asking, would this be a supplement that we need to take for the rest of our lives? What is your response?
Well, my opinion is yes. That's what
if you do, it's kind of helping to build that savings account, so that if you have a unexpected insult, concussion, injury, illness, you're able to build this up. Is that correct?
Yeah. Well, look, I'm 54. I've obviously been taking them for years. I've made these things for my family. So these are things that we all take. And so I'm not like, I do my blood work and my plasmalogens are high. I'm not stopping taking them. And the ability to restore the brain volumes and structure of my brain over that 17-month period and continuing onward is the ability to create the sustained surplus. So yes, I think for optimal health, for optimal neuromuscular performance, yes, it's something. And then you can decide a little bit or a lot. It depends upon the individual.
Yeah.
And that's kind of where it is. But it's food. It's kind of like, should I, do I have to stop eating protein?
Vegetables.
Right, exactly. So I think you have the amount that you want to supplement with it can be changed. And I think with all of our staff at the company, that everyone has tried different dosages themselves over time, and they've I think they've all kind of found their happy place.
Yeah.
So you can measure your blood work, and that's the whole point about Prodrome Scan is to be able to look at your overall physiology, see if there's anything lurking out in left field that you had no idea was there, get your health restored, get the systems the way they're supposed to be working, and hopefully remove some of the anxiety, right? You can't eliminate every single risk factor in this world, right? But you can certainly minimize the big ones.
Absolutely. Couple more questions. Thank you all so much for your thoughtful questions. There's some really great questions in here. Robert Franklin asked, do the different types of plasmalogens treat different diseases? Do autistic patients take something different than the Alzheimer's patients or MS patients? Which I think comes back to one, why it's so important, if possible, to work with a certified practitioner who really understands your body and these things inside and out. But I think we can speak a little bit to the different products you have, right? The neuro and the glia.
Let me speak in generalities, because there are general rules that can be broken in some individuals. But as a general rule, for autism, ADHD, it's almost entirely the prodrome glia. You want to restore the myelination process, which is the omega-9. Omega-9 is very calming. It reduces inflammation of the brain. It causes the person to be more calm, centered, improve sleep. So those are your number one priority. But
you sometimes say that the glia helps with the signal, like you're restoring the signal and
it's a tuning fork. Glia is your tuning fork. So glia fixes the myelination and allows the neurological signals to move smoothly. And when you reduce that noise, we're seeing serendipitously other aspects of just calmness, feelings of wellness. People say that they feel normal for the first time in their life. Their seeking behavior kind of normalizes. But now once you, in the autism ADHD space, that there's that inflammatory component of it. But once that's under control, there are some individuals who have benefits with adding neuro on there. So neuro is the volume. So glia tunes everything up, neuro cranks up the volume. So neuro is stimulatory. It makes the lights brighter. Okay, it makes your brain sharper. It is very powerful cognitive and neuromuscular stimulating molecule. And so for people with autism and ADHD or bipolar, I always say be very careful with that, because you're activating someone who's already potentially hypersensitive or hyperactive. Okay.
Yeah.
But for most of us, for Alzheimer's, most of us with age-associated cardiovascular, age-associated just reduced function, the neuro is by far the most powerful. But as we get older, we take both. Like I take glia at night, neuro in the morning. Glia to restore myelination at nighttime, improve my sleep, and I take neuro during the day for just enhanced function during the day.
And someone in the questions asked, or chat has asked about MS. Would that be both, or?
Well, it depends on the age. So younger women with MS is mostly the omega-9. Okay, so MS is a strange disease. Well, it's not really a strange disease. It's kind of the female version of autism. So you get the reversal of the 3-to-1 gender bias. So relapsing remitting MS happens mostly in women. And early on in life, you get this very long relapsing remitting phase. And then MS doesn't really get super serious in females until menopause. And then that's when most MS transitions into secondary progressives. So early on in the MS pathway, the anti-inflammatory, the myelination, restoration, the glia is the most important. And then later on, you need definitely both, because later on you get the cognitive issues. So early MS is really a white matter disease. And as it gets later, when you have the other more serious aspects of cognitive decline, gray matter loss in the brain, that's where the omega-3 comes in. So again, there's more advanced MRI that we can do that are available for people with MS. But as a general rule, step one is restore the myelination.
Thank you. Another question from Jim. He's not able to eat fish or shellfish because he has an allergy. Would he be able to take the Prodrome products?
Absolutely. Yeah, there's no fish, shellfish at all. The source of the DHA itself is from algae, but by the time it goes through our purification process, quite frankly, we could be taking it from the bottom of the ocean. It would still come out clean. So but there's no animal product whatsoever in the Prodrome Neuro. So you should have zero. If you have it, it won't be from a fish allergy. That's for sure.
And are there any medications or supplements that people cannot take while they take Plasmalogen? And is it safe for someone who's pregnant?
Well, we have people. So yeah, so the answer is, for the first one, safe while pregnant, absolutely. Because essentially, and I think we'll be looking at it more and more into maternal health, especially for all the issues that happen, brain fog, and, a pregnant woman is still a person. Okay, so they still have their health to deal with. And so maintaining optimal health is good regardless. And then, of course, in terms of placental transfer of nutrients to the developing baby, absolutely, you're going to want to have that, especially in the third trimester, because human brain in utero doesn't start myelinating till the last 8 weeks is when you start seeing, from the 32nd week to the 40th week is when you start seeing brain myelination occur. And then it steps up a lot more after that. So, and we have anecdotally definitely pregnant women taking plasmalogens. So there should be no issues with that whatsoever. Adverse reaction or contradictions with other therapies, I think, like anything, you should take it step by step with your
and with the doctor.
And with the doctor. We don't have anything on our radar. Like there's nothing that says, that's come back to us from, we have thousands, I don't know, just under 10,000 probably different unique people out there. So, and we we welcome people's feedback loops, and because we want people to find the right way to work for them. Because some people say people that have pandas or they have the really acute syndromes, they need to go slow, and you need a doctor to walk you through that kind of stuff. So it's for most of us, you can do almost anything you want, but when you're dealing with significant situations, you're going to want to make sure you've got a professional. And that's why we do the education. That's why we do the certification process.
Yeah, I think someone in the chat had asked their doctor who wants to start to implement some of these things into their practice, so that there's more information and they can figure out how to become a certified doctor and take educational courses at drgoodnow.com. Thank you for asking that question in the chat. And, like Dr. Goodnow was saying, this is a product that he has spent years developing and has done the research on, but it's really on you to make sure that you're working with a doctor who can help guide you through this process, because everybody is different. And we're seeing some incredible results. And like he said, this is a new thing. So please share your feedback and your stories. And thank you all so much for joining us. I want to be respectful of everyone's time. We're going to end with one last question. There's also the company emails on their websites. Please feel free to reach out with any more questions that you may have. We'll take our last question from Casey. She said, my 14-year-old son has a rare genetic disease, ALD, that causes a buildup of VLFCAs, which attack the myelin sheath. Is it possible? How can I enroll him in one of your projects?
Yeah, so please reach out to us at info@drgoodnow.com. The leukodystrophies, so very long chain fatty acids. Plasmalogens are made in peroxisomes, okay? And they're made from peroxisomal beta oxidation. So the building blocks of plasmalogens come from peroxisomal beta oxidation. And one of the sources of peroxisomal beta oxidation is very long chain fatty acids. So the only place in the body that these VCLFAs get processed is in the peroxisome. So children with X-linked adrenoleukodystrophies will have a demyelinating syndrome because of that. So that's actually a really perfect question, because with a lot of these genetic diseases, everyone chases the genetic cause. How do I fix the genetics? How do I fix this protein that's not doing very long chain fatty acid beta oxidation? When that's important, obviously, and you want to make sure the diet is in such a way that you're not making it worse. Like a child with Refsum's disease, right? You want to make sure they don't have phytanic acid in their diet and stuff like that. But and same thing for here, you want to make sure that you have a diet that's low in very long chain fatty acids, but you also want to keep inflammation to a minimum, because a lot of the very long chain fatty acids are made in the body through fatty acid elongation rates. I know I'm getting in the weeds with you guys here. I'm sorry. I'm a scientist. That happens. So the answer is yes. So we want to just restore the myelination, right? So like at some point, just say, let's just fix what's broken. Let's not worry about. And so, yes, the answer is absolutely 100% yes. And we have multiple children with different types of leukodystrophies, and that have that same type of issue. But absolutely contact us at info@drgoodnow.com, and we will see what we can do to help.
Thank you all so much for joining us. Thank you for listening till the end. There is going to be a coupon code for our webinar attendees. This coupon code is Plasmalogens25, and you will get 25% off your first order on the site. We really appreciate you joining us tonight and taking the time to understand our story and the journey and the science behind this product. And most importantly, thank you to Dr. Goodnow, the man behind these medical miracles. We are just so grateful for your relentless dedication to this work. You're one of the few people I've seen really walk the walk, and you do what you say you're going to do. And all of your work and the people you've helped, it's just been so inspiring, and just really appreciate your time tonight. And thank you all for joining. So in the chat is the link. It's Plasmalogens25. Enter this code when you check out for your discount, and you'll see it at www.prodrome.com.
Awesome.
Thank you, everybody.
Here's everybody.
Thank you.